want to stress again that there's no perfect answer. There's no guarantee for anyone. This affects every single person differently. We have no idea until you are positive with coronavirus how your body will respond. Personally, I think very much this is a very important video because I think the most important strategy here is to prevent everyone from getting to that point where they need the hospital, okay? So the most important thing that we can do is to treat ourselves at home within reason, following, a lot of guidelines as best we can. I know it's new to a lot of people, but we want to avoid that 911 call. This particular virus, COVID-19, very little scientific data is available. All we have are theories, all we have are applied data that we have for other viruses, and we have, ancient knowledge for centuries of other cultures sharing ideas. I was thankfully able to get my hands on absolutely everything, and a lot of things have been tried on me. Alright, so I have a disclaimer here that's really important for you guys to follow. The most important thing here is that magic works differently for everybody. There's variables for everything. It's completely inconclusive, so we don't have enough time or energy or participants to test every single piece of magic on every single known virus, on every single person. It's just impossible to have enough scientific data on all of this information, especially since this is a new virus and we have absolutely no information whatsoever at all. So all we can do is apply what we know to this virus and hope for the best. This information is ancient. This isn't the first plague. You really must know your own limits. I am not responsible for anything that goes wrong, okay? So do your own due diligence. Test an area to make sure that you're not allergic to something that I've suggested. Ask your doctor. Do a drug interaction checker, please. Make sure that the drugs that you are currently prescribed to are cross-checked with anything that you have been suggested to take for this coronavirus or are suggested by this list that I have. You can go to WebMD and look at your medications against pretty much anything on this list. If it's not on this list, ask your doctor to see if there's any kind of conflict, if he's available. Everything that I'm suggesting must be practiced safely. Everything that I have suggested needs to be practiced safely. Please. Read the label. Follow the instructions. Okay? Too much mustard can really, really hurt you. Garlic is antiviral. It helps your immune system, but that doesn't mean that you go and take 10 bulbs, mash it up into a smoothie and drink it, because you'll get sulfur poisoning or other poisoning. It just won't work, okay? It's not the right thing to do. What you want to do is you want to try and trick this virus into not knowing what's coming at it every 2 seconds. So, don't only rely on garlic. Rely on everything that you have. There are lots of things that we can use, and it's about attacking this thing that's growing inside of us that requires certain things to be comfortable, and we want to make it as uncomfortable as possible while supporting our body. And just, take full accountability of your own health care. We are all responsible for ourselves. I cannot stress that enough. A doctor has to be responsible for a big list of people. They're responsible for a lot of things. They have a lot to remember already. It's really hard for them. I can't imagine, okay? I try to do everything that I can to make their job easier. So that's my disclaimer.